We have Dr. Vishwas and Dr. Pradeep with us today, and we're going to be covering a very important topic which is called OAB. Alright, so according to you, Vishwas sir, I would like to know that can you please describe our audience who are watching this channel, what is an OAB? A very layman definition.
OAB means overactive bladder.
Yeah.
And it is quite a prevalent problem in Indian society. In general, if we see after the 40 to 50 years of the age, almost 25 to 30% of the females have the overactive bladder. So the overactive bladder is there is increased frequency, अर्थात यूरिन बार बार आना, urgency एकदम से यूरिन आना, and urgency incontinence may be कि जाते जाते यूरिन लीक हो जाए. So it's quite a prevalent problem, but because of social inhibitions है ना, most of the females जो भी rural areas में रह रही हैं, they consider it as an age related problem, but I think it should be considered as a problem, and if they come and take the proper treatment, and it can be cured.
Dr. Pradeep would like to know from you, how does this problem can impact a person's social life, to be precise? How this can impact?
Actually, this is very common in both male and females, but in females it's quite bothersome many times because they usually avoid social places where there is no washroom and avoid social gathering because of this condition, because sometimes it's urgent desire to void and there is leaking of urine and leads to uncomfortable for the patient, so it affects quite their social life.
Okay. So Dr. Vishwas would like to know from you, if a person is delaying their diagnosis when it comes to OAB, what could be the consequences that he might needs to be faced?
The thing is that symptoms may worsen and the quality of life and the social life will hamper. As a patient, if you have a fear of increased frequency, leaking of urine, so her self-esteem will be decreased and the person will avoid the social gatherings, all these things. So patient should do the proper consultation and should start the treatment.
Can you also recall one of the instance where you had a patient who did a very delayed consultation and then the problem was worsened?
If you see in India, most of the persons comes into the delayed phase because for the most of the Indians, health is not a priority basically. There are so many things for them.
So what was the impact, for example, if one of the instance we talk about, what was the impact
of... The patient was leaking the urine in her clothes.
Oh, I see.
Even when the patient come to the OPD, the smell of the urine was coming from the clothes.
They used to, they train themselves, they are using diapers because there is no solution for them, but they don't consult for this. And even because of this social embarrassment, they just get depressed.
Do you guys think that there is the lack of awareness here in India about the same topic? Yes, there are?
Yes, there is a lack of awareness also, but the awareness comes from the inside basically.
Yes, actually. Well, Dr. Pradeep would like to know from you, what does the behavioral therapy does when the patient is into this particular condition?
There are many treatment options and modifications we can do. In many patients, there is no cause. But when many patients are having a cause, and when we can rule out them with these, like avoid caffeine intake, water intake to be adequate, not in the excessive or lesser amount. So by bladder training and retraining, we can do. Kegels exercise sometimes help when patient is having stress incontinence. So not OAB exactly, but stress incontinence we can help in them.
So these are the lifestyle modification one can adapt in order to avoid these sort of problem. Thank you so much, gentlemen, for being here.
Okay, thank you.
Very glad.